Welcome to North Tees and Hartlepool Voices, telling the stories of our people and community in our trust.
My name's Elliot Kennedy. In the studio today we have Chris Hand, who is the Trust Finance Officer. The NHS finances are rarely out of the news lately. Can you outline very simply how the NHS finances work and where does money come from and how does the Trust manage the finances?
Yes, hello Elliot, and thanks for having me. I will certainly try to do my best. So the money that the NHS spends comes from taxpayers. So the government raise money through taxes, and then through Parliament they set the national budget that's available to the NHS to spend. And I think it's about 170 billion this year overall. And that funding then gets allocated down to each local area called integrated systems, ICSs, using a funding formula based on the size of the local population and their relative health need. And then the commissioners in each local area, which are called ICBs, use their share of that NHS budget to buy services from local providers like ourselves. So as NHS trusts, our group gets paid income, and it's based on a national tariff for each of the patients we treat, and that income that we get determines effectively how much we can afford to spend overall as a trust. And based on that overall trust control total, each ward and department has a budget available to them for the year, which they spend on all the things that they need to be able to deliver the services required of them. And in the NHS, most of our costs relate to our workforce, our staffing, so we spend about 2/3 of our NHS budget on our staff.
So what does our group financial picture look like?
So NHS finances overall are currently in a very challenging place, which I'm sure you'll have seen in the news recently. Over the last few years, we've seen quite a lot of growth in the cost of running the NHS, particularly during the COVID pandemic years. And we've seen large increases in the number of NHS staff that we employ. And as in a health service, we are now basically spending more than the taxpayer can afford. And that's the position at all levels of the NHS. So it's at a national level, it's regionally across the whole of the North East, and also locally within our group. So we have both trusts with an underlying financial deficit, which means we're spending more than we can afford. And over the short term, unfortunately, again, as you'll have seen in the news recently, that financial picture for the group and the broader NHS is going to become increasingly challenging. So as we see the national funding levels in the NHS reset back down to those affordable levels for the taxpayer.
Now, when I spoke to Stacey Hunter, she outlined that there was a need for our group to pull together, reduce our costs. Can you offer some tips to other staff, regardless of their position within the trust, how to reduce costs?
Yeah, absolutely. I think we can all make a huge difference. It's the daily choices that we all make that decides how we spend our money. We've got a share of a limited NHS budget that is a very precious thing. And every pound that we waste means that there's one less pound that we can spend on our patients when they need us the most. So there are very simple things that we can all do just as we would do at home. So like not wasting energy, switching off lights and computers when we're not using them, reducing waste, so not printing things off unless they're really needed, properly segregating our recycling, and also things like reporting any maintenance issues early so that we can get them fixed before they become too expensive to mend. And it's about making sure, I think, that we understand how much the things we use cost so that we don't use something that's really expensive when there's actually something much cheaper that we could use and get the same result.
They all sound a little tad easy. Is this a case of looking after the pennies and the pounds look after themselves?
Yeah, I think that's probably true. If we all pull together and care about the precious NHS pennies that we're being entrusted with, then the pounds will look after themselves. But it's also about working together as teams, I think, and to challenge our current ways of working so that we can innovate and improve things and remove any unnecessary steps or duplication. If we can find ways to see just one extra patient in every outpatient clinic and every theatre list, or reduce their length of stay in a hospital bed, then we're making things better for our patients, and we're also making best use of our NHS money too.
What else is the group doing to save or even earn some money?
Well, every year the NHS is set an efficiency target that it has to meet, and this year's no exception. So all our care groups and clinical collaboratives and corporate areas have been planning across the group, and they're working hard to deliver their own local efficiency programmes. So we're looking at lots of things, but things like saving money from procurement, so buying things for cheaper, medicines optimisation, looking at our rostering and reducing agency and premium costs, any opportunities from digital and IT and within our back office and admin costs, and making sure our clinical coding is really accurate as well, because that's really important to make sure that we get in all the income that we are due. There's also lots of work going on around reviewing our elective activity and making the best use of the new surgical hubs that we've got as a group, so that we can see even more patients and drive down those longer waiting times and earn more money again for the group. And our new clinical boards are reviewing the service models right across the group, looking those opportunities that being a group that University Hospital Tees gives us, that are going to both improve patient care but also give us more cost-effective care.
Now, finally, is there one message you'd like to give to our colleagues to take away and consider what it would be?
I think the one message is that we all have a collective responsibility when we work in the NHS to do the very best for our patients, and that means making the very best use of every single precious NHS pound that we've been entrusted with.
Chris, thank you.
Thank you. Thanks, Elliot.
Thank you for joining us. Till next time, you've been listening to NTH Voices.